All right, well, welcome everyone. Thank you for joining me for today's conversation on COVID-19, which it's hard to believe that here we are in 2022, still talking about this thing that we thought was going to be 2 weeks. And so I know that is something that a lot of us didn't expect, but I feel that the conversation is now starting to shift a little bit. And we're now looking at these gap of questions that a lot of individuals have. And specifically today, we're going to be talking about children. Now, while pediatrics is not necessarily my specialty, what I do know is that medicine works across the lifespan, and I have children of my own. So I have a personal vested interest in this topic, because ultimately what we want to do is we want to make sure that we're making the best decisions for all people. And so what we're going to be talking about today is kind of looking at the myths and misconceptions of COVID-19 vaccination, as well as talking about how vaccinations work and what the evidence is pointing to for specifically children. Now, what's interesting about this is I like to take a little bit of a different spin. As you probably know, I've been a registered nurse for 22 years. And with that being said, a lot of my work also it spans different organizations. It spans a lot of different modalities as well. So we're going to be kind of looking at things from a two-sided approach, both science and then also just being real and looking at the human relationship piece. So I'm going to start by sharing my screen here. Just giving me one moment while I do that. And then we will go ahead and get started. And again, if you have any questions, please write those down. If I don't answer them through the presentation today, I'm more than happy to reserve time at the end for us to take care of that. So I'm just going to make sure that we're sharing the appropriate screen here. All right, so again, my name is Elizabeth, and I've been a registered nurse for 22 years, working in the fields of education, public health, emergency medicine, and most recently as a consultant with my own company, working with healthcare organizations and education teams as well. I recently became a certified Johns Hopkins University COVID-19 ambassador to help bring the most evidence-based and up-to-date information to you today. So the first part of this series, what we're going to be talking about in part one is how do we protect what's most important? Because ultimately it's different for all of us. And so I help, kind of clear the air on what are the things that are most important to you and what are the things that are most important to your family and how those decisions impact our community and our world as a whole. The next thing we're going to be talking about today is the immune system, giving a brief overview of the immune system and how vaccines play a part in disease prevention or control. And then the last thing we're going to talk about today in part one are the common myths and that are associated with vaccination, specifically with COVID-19, but also looking at it as a whole. And then lastly, talking about vaccine acceptance, because there's a whole continuum of vaccine acceptance. So hopefully that will answer some of your questions and help you to feel a little bit more empowered when you're presented with questions from family members or from the community. And be sure to join us for our next series, part two, where we'll go a little bit deeper and how we can best support children's well-being and how to best make an informed decision, because ultimately it's about empowering you with the right information so that you can make the best decision for you and for your family. So the conversation really is going to be based on three things. First of all, it is extremely normal to have questions. And I encourage questions because that encourages deeper thought. A lot of people, when we're looking at decision making, we tend to make, as humans, especially under pressure, we tend to make very quick decisions. And it's really a great practice to kind of pull the lens back a little bit. And when we're making our decisions, making sure that they are in the best interest of our families, of our communities, and life as a whole. And secondly, this is going to be science-based support. So again, talking more on the science side and really breaking it down into chunkable, eatable steps that we can all digest and deliver. And then knowing I will give you that at the end, some credible resources that you can look up if you want to do additional research on your own. And the last thing is to talk about how vaccines are just one tool in our toolbox to support well-being. And so we'll be looking at different modalities in part two for that as well. So the first thing I'd like to talk to you about is what is most important to you. Now, often we are not asked this question. In fact, if I were to pose that question to most of you, When's the last time that a healthcare professional asked you that question? What is most important to you? And of course, often we're met with an initial response, but a lot of us would say that, health, well-being, family, financial support, autonomy, the ability to make our own decisions. Those are the things that are usually most important to us. So I want you to think about that for just a moment. And if you're tuning in now, I would encourage you to write down what is most important to you. Now, even if you say something like this is a picture of my two daughters, and of course they are not this age anymore, but when they were 6 and 1, I bet you the things that they said were most important to them at that age are different than they are now. Now, my youngest child, she is very driven by money, and that is okay, except she doesn't have a lot of it. And so why it's important to her is because it's tied to a value of autonomy, of independence, of being able to make her own decisions. And for her, money gives her that freedom and autonomy. And so even if you're putting something down that maybe others would, not agree with in terms of what's most important to you, take a moment and just drill down, what is it connected to and why? So while this, the purpose of today's exercise is not to spend the rest of our time on our values, it is a perfect place to start because all of our decisions do flow from what's most important to us. So when we look at what's driving our decisions, well, there's 3 things that tend to drive our decisions, even if you're not aware of these things. So most of our decision-making, anywhere from 80 to 90% of our decisions are made unconscious and automatic. So I'm going to say that again, 80 to 90 and even upwards of 95% of our decisions are made automatically and unconsciously. So where do our decisions then come from? Well, they come from these 3 areas. They come from our upbringing and our social norms. Now, social norms can extend beyond our community. They can go as far as our nation, as our world, or even as intimate as our household. And so all of us have a different upbringing and have different things that were instilled in us on what drives our decisions. The second thing is our previous experiences. So maybe in the case of a vaccination, maybe you had a previous experience that wasn't positive. And so the tendency for the brain is to refer to that as your safety. So your brain will say, don't ever get another vaccine because you remember last time what happened. It's the same thing when we eat at a restaurant and get food poisoning or get an upset stomach. Our brain will tell us and remind us, don't ever eat sushi again because that's how you got sick last time. So our previous experiences, whether they're internal or external, will influence our decisions. And the last piece here is almost looking at the brain as 2 different entities, because we have our automatic brain and then we have our conscious brain. Well, what we believe to be true is usually locked into our subconscious. And so when we're looking at our decision making, we have to filter it through these 3 lenses to understand, is this something that I'm reacting or deciding out of fear? Or is it something that I'm really taking a conscious effort into exploring? Why do I believe the things that I do? How is it tied to my values? And is it actually true? So now let's pivot. We're going to pivot now that we've laid that foundation of looking at what's most important to each one of us, how we make our decisions. Let's start talking about the immune system and vaccines. So when we're looking at the immune system, we understand that the immune system is developed in utero, or in other words, when an infant is in their mother's womb, we start to develop an immune system. And the moment that a baby is born, they have an immune system. And they rely on cues and bacteria and all types of things in the environment to help develop that immune system. Now, the purpose of the immune system is to keep us well and to, attack invaders and keep the microbiome, which is another word for the bacteria load in our bodies, keeping it level, keeping it at our best. And so when we're looking at the immune system, we understand, if I were to ask, a lot of people would struggle with this question, where is your immune system? There's not like a little box that we keep and that's where our immune system is. But I will share with you that the immune system is very complex. And a lot of the immune system is located in the gut. So gut health, again, a total different conversation for another day, is imperative for a healthy immune system. So when we're looking at what does the immune system fight off? Well, without going too deep into all of the different conditions that are affected with the immune system, let's talk about what are the things that the immune system fights off. In simple terms, think of it like an army. When we look at an army, we know that there are friends and there are foes, there are enemies, and there are those that are on our team. So in our body, we have bacteria. On our hands, we have viruses, and most of them are not harmful. But when these bacteria, these viruses, fungi, mold, all of these different organisms become what we would say pathogenic, that means that's the ability of that bacteria to make us sick. So that's why we can, do a swab of the hand, find a bacteria that's not really harmful, or that we find certain bacteria in our gut and it's not causing disease. The difference is there are certain ones that in certain levels will cause disease. Now, in the case of COVID-19, what we're looking at is a virus. So this is a coronavirus. And in this case, a virus has a particular shell that allows the inside of the virus to replicate. And that will be done, but it needs a host. And unfortunately, in the case of COVID-19, the host is a person. All right, so going back to the immune system a little bit, we understand, again, this is like an army. And so the army that we have in our immune system has fighter cells. And these are specific cells that are designed with a specific mission to fight off infection. Now, remember, there are pathogens, and this is disease-causing bacteria, viruses, etc. And they will teach the immune system to create something called antibodies. Antibodies are like a mirror image of the bacteria, but giving our own body the ability to say, hey, I recognize you, you're not going to make me sick again, and will create this perfect storm to be able to eradicate the bacteria or the virus. Now, here's an important piece to understand. Our immune system is not just active when we're sick. Our immune system is active 24 hours a day, 7 days a week for our entire life. And there are so many things that affect our immune system. And we'll be talking about this a little bit more in part 2. Things as the food that we eat, the medications that we take, the stress in our lives, the amount of sunlight that we get, and certainly the amount of sleep that we get are all tied to the immune system. So how do vaccines work in the immune system? You've probably heard a lot of people say, well, I've had XY disease, so I don't need the vaccine. And in the case of COVID-19, there's been a lot of discussion about people that have had COVID and saying, well, I don't need the vaccine because I've had COVID. Well, and the easiest way to explain it is we do have two different immune systems. And we'll be talking about that shortly. We have natural immunity and vaccine immunity. So how vaccines are working in the immune system is they create a memory. Again, they create those antibodies, and it's stored in if you want to think about it like the back closet where you keep things from 1984. This is where our immune system will remember, I've seen you, I know what to do and to take care of it. If you've ever noticed a time where you feel like you're getting sick, and then it starts to kind of go down that hill, but then all of a sudden, within about 12 to 24 hours, you're like, you know what? I'm actually not getting sick anymore, and I feel like I'm getting better. This is often because of antibodies. Perhaps you were exposed to a virus or bacteria that you've been exposed to before, and your body remembers it. Now, in the case of viruses and bacteria, what we hear a lot about is mutation. And so we know that COVID-19 has mutated several times, henceforth the term variant. These are different mutations that try to trick the body into understanding I'm not the same guy that came before. And so it's nature's way of trying to survive. And again, we're the host. So without sounding too scary, let's talk a little bit about why vaccines often need multiple doses. This has been a question that I've seen a lot of times. Why do I need a booster? Why do I need several doses? Well, when we look back on childhood, we see that there are several vaccine preventable diseases that require several doses. And the reason for that is it teaches the immune system each time, remember this guy, remember this guy. And just like the booster sounds, it gives a boost to the immune system so that the immune system goes, oh, that's right, I need to remember this because the disease is usually far worse than the vaccine in terms of side effects and symptoms. So some vaccine preventable diseases need multiple doses as additional training. It would be no different than us going through this class today. And then, you know what? I don't know if I got everything last time. I'm going to listen to it one more time just to make sure that I absorb everything that I need to know. So when we're looking at the different types of the immune system and how vaccines play into this, this is where we have those differences between natural immunity and vaccine immunity. Now, natural immunity is just like I had said earlier. This develops in response to an infection. So maybe some of you as a child had chickenpox before you maybe had a chickenpox vaccine. I was one of the lucky recipients of chickenpox disease. So I'll never forget it. I was in 6th grade. It was spring break. So it was around this time of year. And I got chickenpox. Now, this was before the vaccine was recommended at ages 1. So I got chickenpox. So therefore, I developed natural immunity to chickenpox. But here's the caveat with natural immunity, and this holds true also for COVID-19, is natural immunity does weaken over time, and it's often shorter in duration. So the protection is a lot shorter. And the likelihood to be reinfected is more common with natural immunity. Now, on the flip side, with a vaccine immunity, this teaches a different part of the immune system. So think about it like short-term memory versus long-term memory. Short-term memory is more like natural immunity. So let's give an example of short-term memory. That would be what I had for breakfast this morning. Until probably, I don't know, tomorrow or maybe even a couple of days from now, my brain may remember what I had for breakfast this morning. But imagine if you had to remember every single breakfast over the course of your life. Your brain's like, I don't need this information. So it gets rid of it. That's like natural immunity. It's that short-term protection. Now, vaccine immunity, on the other hand, is long-term protection. So this is like long-term memory. So if you think about maybe you remember your childhood best friend and where they lived, or your elementary school teacher's name, or the smell of crayons, something from your childhood from a long time ago, even if it seems insignificant, for some reason your brain decided, this is important, I'm going to hang on to it. Vaccine immunity is the same way. It's usually longer lasting, and it cannot give you the disease. Now, no vaccine is 100%, and we do understand that, but it does lessen the severity of the disease symptoms. So again, it's giving that boost to the immune system to say, I recognize you, and I have built up the antibodies to know how to handle it for a longer period of time. All right, so how is COVID-19 transmitted? Let's just do a brief overview of how it's transmitted. So the first way is direct transmission. So let's just say for example's sake that I have COVID-19, I have coronavirus in my system. And I don't know it yet because maybe I'm not symptomatic. And I come in contact, and heaven forbid, maybe I sneeze on someone without covering my hands. And in that sneeze, so in the saliva, is the virus. And that's how one of the ways that the virus transmits, because it'll cause different irritations into the nasal cavity or into the chest and create that sneeze response. And it loves it because that's a direct train ride into another host. Another way that COVID-19 is transmitted is airborne. And unfortunately, this is invisible particles in the air that we can't see. Now, there's been lots of videos that you could probably see tests. Think about it like this. When you go outside on a cold day, you can see your breath, but on a warm day, you can't see your breath. It's very similar to that in terms of airborne particles in the air. And of course, if you think about it, being outside versus being in a crowded indoor space, you're going to have a lot more particles in a crowded indoor space without adequate ventilation. And the third way that COVID-19 is generally transmitted is indirect. Now, this one is a little bit less likely in terms of severity, only because viruses do require a host. And so they need some living tissue in order to replicate. So an indirect method would be if I sneezed on my desk, and then maybe a day later, somebody touched my desk and it wasn't clean. And then they put their hand near their mouth. That's how the virus can be transmitted. Now, this is how also the virus can turn into a disease, because maybe you've gotten exposed, or you've heard of people that have gotten exposed and they didn't get sick. Well, a lot has to do with what's called viral load, and that's the amount of virus. So think about it as the good guys versus the bad guys. If there's only one or two bad guys, chances are my immune system can handle it. But if there's about 250,000 bad guys, my immune system is going to have a harder time handling that. And that's where you'll start to see symptoms, because the viral load, the virus likes to replicate in a host or in a living body. So let's talk a little bit about briefly the ways that we can prevent COVID-19. Again, this talk today is not just about vaccination, but it's looking at all of the ways. And there's a common concept called the Swiss cheese model. And when we look at the Swiss cheese model, if I were to take pieces of Swiss cheese and stack them on top of each other, it's very unlikely that I'll have a hole directly through all of the cheese layers. And that's exactly how prevention works, is we want to layer things that are maybe not perfect, because we don't maybe wash our hands perfectly every single time. Or maybe we forget our face mask, or maybe the face mask is 99.5% effective. Maybe we had to go into the store that one time and we forgot to wear a mask. And maybe we've been vaccinated. So all of these different layers piece together to make it more unlikely that we'll be infected with the virus. All right, so I'm going to pause there for just a moment, because that's a lot of information. I'm going to come back on screen here, and let's just see if there are any questions about those pieces before we move on.
Yeah, I have a question or just a comment about the natural immunity and the vaccine immunity. I'm glad that you explained that. I didn't realize that there are two different tracks. And so what you often hear, especially with people on the news when they're talking about not getting the vaccination, they always talk about their natural immunity. And so I'm glad that you pointed that out, that there are two, and that, yeah, there is natural immunity, but with particularly in this one, it would be a beneficial aspect of prevention to also get the vaccine in addition to the natural immunity. So I often hear people that have had COVID, they're like, oh no, I don't need the vaccine because I've already had the disease. So I'm glad that you pointed that out. Also, do we know how long that it will live on a surface?
Thank you for asking that. I think the research has changed in terms of that. In the very beginning of the pandemic, it was upwards of 3 to 7 days.
Wow.
It was living on a surface, which is crazy to think that it would be that long.
Mm-hmm.
And different types of surfaces, they've done tests to see like metal versus wood versus plastic. Different types of surfaces last longer. So I guess as a rule of thumb in my head, I just assume a surface is dirty unless I've cleaned it.
Right.
Yeah.
Right.
So I would say, probably, again, without specifically looking up the current research, that 3-day mark is very likely.
Right. And that's why when I'm at work at a patient's house, when that nurse leaves, I disinfect everything, the chair, not that I think she's dirty or anything.
Oh.
But, I'm just like, she could have eaten there or she could have sneezed there. And so I always disinfect, everything before I even put my pen or paper or anything there. And also, in regards to the booster, is it just one booster available now? I mean, I had one booster, but is it recommended that we get additional boosters beyond the one booster?
Yeah, so that's a really great question, Carla. And there is recent evidence to show that there are people with conditions such as a weakened immune system or over the age of 65. Since the immune system, and it's very convoluted and complex on how the immune system works, but those individuals tend to not have the big, robust response to produce enough antibodies as someone who's younger or doesn't have a compromised immune system. So there actually is some evidence to support a fourth booster for those age groups, depending on the vaccine.
Okay, all right. So those are my questions. Anybody else have any?
No, those you pretty much asked the same thing I was going to ask, Pastor. But the one thing I would add, one of the slides you talked about past experiences, previous experience with people, and so that to me touches back on the historical reasons why you may have people not wanting to get the vaccine, going all the way back to the Tuskegee experiment.
Yes.
People still have that mistrust that are, elderly, and just mainly the fact that historically there's not a lot of people that even know about the experiment. And when you ask them about it, oh, I never heard of it, or do you mean the Tuskegee Airmen? No, that was important too, but I'm talking about the experiment that lasted over 40 years that devastated the Black community. So
right.
That piece of it, and then you still have, even now, I just spoke with one of my cousins the other day. She's 85, and she says that for the last few weeks she's had this cough that is intermittent, but comes and goes. But she refuses to get vaccinated. She gets tested, but she won't get vaccinated. And you were talking about this natural immunity, and she believes that her body just fights it off naturally, that she doesn't need these shots. But that is still out there, though. So I'm glad you touched on that. So thank you.
Yes, thank you so much, Wayne, for giving that personal application. And I'm glad that answered some of those questions for you. Dwayne, did you have a question as well?
Yeah, I was trying to adjust my phone there. No, you talk about how things changed. And, when this COVID first started, Dr. Fauci was saying, now this was during the Trump administration, Dr. Fauci was saying, no masks. We don't need masks. There's no need for masks. After the change of administration, masks became the thing to do. Now, Fauci could be taking the moral high ground by saying, I told people to put masks on and not. But what else have changed in the COVID sphere, spectrum of how it's prevented other than just the mask?
That's really great that you bring that up, because what that speaks to is it adds to the hesitancy when information changes. And that can be really tough for people, because when information changes, you're like, wait a second, I thought you told me I needed to do this, and now I need to do this, and now I don't do this. It can feel inconsistent. Here's what we know about science and about research is it evolves all of the time. The difference is we're just hearing about it now. So when, research studies are conducted, there's a constant pivot where at first, okay, we thought it did this. And then all of a sudden when it mutates or when something changes, we're like, oh, it's not. It's as we continue our research and get deeper, we're actually finding it does this. But what that does to the public is it can reinforce fear, anxieties, or inconsistencies in decision-making, and that's hard. So do I have a full answer? No, but to help support on why it seems information changes. Does that help? Does that help a little bit?
Yes, it do.
Okay, thank you for your question too. Anyone else before we continue on with the second half?
Just one more quick note, please. We have to recognize too, as Black people, especially in Wisconsin, COVID rates affect us differently. So we're more likely still to get COVID than other races. So in terms of ethnicity, we need to really make it known to people that our rates for getting COVID differ than from those of whites, and that we are still very much not out of the woods in terms of of whether or not we're safe from this virus. So we need to be mindful about that too.
So important. Thank you so much, Wayne, because that is something that has been clear across the board of the disparities between races and disease. And there are 1,000 reasons on why that is. And it's not just because of pre-existing conditions. It's access to adequate health care, preventative care, nutrition, food deserts. There are so many reasons why. So thank you for bringing up that very important point. All right, so what we'll do is we will go ahead and transition to section 2, which is still part of part 1. We're just going on to the second piece here. So I'll go ahead and share my screen. And again, if questions come up, please feel free to write them down and we'll address them towards the end. All right, so now we're going to be talking more about vaccine myths and vaccine acceptance. And hopefully this will address some of the questions even that we addressed here in the first section. You know, all you have to do is hop onto social media and ask a question or even look up a question and you will see every answer under the sun. And there's a lot of weight when people want to find out adequate and trustworthy information, what to believe. That's the first thing that I get asked is, what should I believe? Well, one of the things that you want to look at is, let's first start by talking about how vaccines are developed. Because one of the things that I've heard is, I don't trust the vaccine because it seems like it was developed really quickly. This is something I've heard over and over again. So let's look at the vaccine development process. Well, first of all, we understand that it does take decades of research. And again, these are things and processes that are happening without our everyday knowledge. It would be no different that if I were to ask you, hey, you know what, can you tell me how microwaves are made? Unless you are in the microwave development industry, most of us don't know. And that's okay, because I feel that it's important that we all have experts in different fields. So we understand that decades of research have already been done on how viruses and bacteria, how they work and how they don't work. The other thing that we understand is because of the different regulating bodies, there are multi-phase clinical trials. And so the clinical trials don't necessarily start with a person. A lot of times they may start with animal research, or they'll study the viruses in a petri dish before they translate it into human clinical trials. And even when there's human clinical trials, to speak a little bit of the Tuskegee experiment, because of that, there is now what's called an institutional review board, where it has to pass this review board before a clinical trial can be done. So clinical trials cannot just, a bunch of people can't get together and say, hey, I want to test this and I want to test it in humans. Now we know that there is an institutional review board between people and researchers and between approval of medications or approval of clinical trials. The other thing that we have available during the development of vaccines, and this goes for medications, vaccines, anything, they're all under this process, is there is also a safety board. So they look, an external board will look at the results, the outcomes, side effects of these clinical trials well in advance of things being approved. Now, what's interesting about the COVID-19 vaccine trials is a lot of people don't recognize that there were over 100,000 people that volunteered in the initial trials. So these were rigorously tested. We also understand that coronaviruses, the family of a coronavirus, which is where COVID-19 comes from, have been studied for decades. So this is not necessarily new information, but if you want to look at it like a new variant or a new mutation that had never been seen in humans before, and that's why it's called the novel coronavirus, or the novel coronavirus, novel meaning never been seen in humans. Since to date, and as date of my research here last month, over 214 million Americans have been fully vaccinated. Now we know that number continues to rise, so that number is probably a little bit different today. Now, when we look at misinformation, there's a difference between misinformation, disinformation, and fake news. You've probably heard all three of these terms used interchangeably. Now, what we do know is all of them are based on beliefs and not facts. So it would be different than me saying, well, the grass is green. Well, the grass is green, but it depends on where you live. It depends on the season of the year. And if I said, well, my grass isn't green, but yours is, well, then that's kind of an inconsistency with truth. So we do know that science is based on truth, whereas misinformation or disinformation or fake news, anybody can get online and use their credentials or make up credentials or make up information that's in the best interest of what they believe. The other piece of that are rumors. And again, the brain will do anything possible to protect itself and to protect what you believe. Because here's the reality, we all believe that we're right. And so if we all believe we're right, everything else that doesn't line up with that is going to be false or is going to look like it's not true. So rumors can start really easily. And, you know, a lot of times I look at that as it is that person's protection, that they're trying to protect what's most important to them. The other thing goes into line with that are fear and emotions. We know that fear drives really knee-jerk decisions. And so maybe I have a fear of, you know, an entity taking my rights away, and autonomy and being independent and making my own decisions is important to me. So anything that comes between me and what's important to me, I'm going to not like it and maybe spread false information. Now, here's what's also interesting. According to a study done in Science Magazine, which is a journal, a research journal, in 2018, is they found that false stories are 70% more likely to be shared on social media than stories that are true. 70%. So it really does give us an idea that we need to be looking at things through a critical lens and not just believing everything that we see. Now, here's the difference between misinformation, disinformation, and fake news. Misinformation is the unintentional sharing of false information. So let's say you see an article and it hits home for you and you share it on social media. Maybe you didn't know that it wasn't correct and you shared it with the true intent of helping people. That's misinformation. The difference then for disinformation is deliberately sharing false information to support your own beliefs. And I'm sure many of you on this call have seen both of those. Now, the last one, fake news, is false information that's packaged to look real. And an example of this would be somebody with a credential that seems supportive. Maybe it's somebody that has doctor in front of their name. And so they share an article or write a paper that supports their beliefs that may not be true information. But since you see the word doctor, you're like, well, I better believe it. It's the doctor. Not understanding that there are hundreds of degrees that can support the name doctor. You can have a doctor of metaphysics or a doctor of philosophy or a doctor of chemistry. It all depends on where their beliefs line up with what's true. Now, there's something I want to talk about really briefly, and this is bias and conspiracy theories. And this goes right up into the vein of dealing with disinformation specifically. Now, again, the brain will do everything possible to make sure that it keeps protected what you believe to be right. And it's crazy to think that, you know, oh man, don't I have control over my own thoughts and my own mind? Well, what's interesting, again, is based on our experiences, based on our values and our previous beliefs, that forms what our brain believes to be true. So confirmation bias, what this is, I love giving this example. So let's just say I believe that there are ants in a hotel that I'm staying at. Even though the hotel staff have told me we don't have ants here, no one has seen an ant, we can't find any ants. Confirmation bias, because I believe it to be so true, I will do everything possible to find an ant. And you know what the possibility is? There probably is one somewhere. All it takes is a crumb on the floor and an ant will find it. So the moment that I find an ant, I say, I told you there were ants in this building and you didn't believe me, and there's the ant. So I can find anything to support my beliefs, just like you can find anything to support your beliefs, and it can go across any topic. So confirmation bias says, even though the likelihood is so slim, if I believe it's true, I can find something to support it. Now, anchoring bias is a little bit different. Anchoring bias is the brain's way of saying whatever you hear first is truth. So if I gave a list of 3 items, you're likely going to either remember the first or the last. That's anchoring bias. So maybe in the beginning of the pandemic, you heard something like, we don't need to wear masks. And then all of a sudden, now we need to wear masks. And then they'll be taken away again. And then we come back. Your brain is likely to remember the first thing it heard as truth. And then lastly, conspiracy theories. These are just based on usually an emotion of fear or a personal belief in something. And again, we can all go down a rabbit hole and talk about lots of different topics and how they can be a conspiracy theory. But let's move on and talk a little bit about some of the common myths, and let's clear these up a little bit. So one of the first myths I hear is the vaccine is going to give me the disease. Well, the reality is vaccines are not made with the actual virus. There's only I believe two vaccines that are made with actual virus, and that is MMR, measles, mumps, and rubella, and chickenpox. They have a little bit of the live virus. Does not give you the disease, but you may have a more robust reaction to the vaccine. With COVID-19, there is no virus in the vaccine. How it's produced is it's almost like taking a picture of the virus, replicating the spike protein, putting that information into a vaccine, giving it into the body. The body sees it as, oh, this must be the bad guy because it doesn't look like my cells, and it produces antibodies. The next myth that I'd like to clear up is that often some people have side effects, some people don't. And so then people are questioning, am I developing antibodies? Well, the good news is most people that have side effects from a vaccine, again, these are things like a sore arm, maybe nausea, headache, fatigue. Those are as a result of your immune system working. It's no different than if you were to come down with a cold or come down with the flu or a stomach bug, and you start to just kind of feel like you're going downhill. It's very similar with this case as well. The other thing, as I mentioned earlier, is no vaccine is 100% effective. I don't know anything in life that is 100% effective. Some people may have an allergic reaction to many vaccines. Some people have allergic reactions to flowers. It's all based on our own genetic makeup and how our immune system works. One of the things that I've heard often too is people being concerned about heart inflammation related to the vaccine. Well, research does support that there are more cases of heart inflammation from COVID, the disease, versus the vaccine. So when we're looking at decision-making, we have to look at which risk are we more willing to take? Are we more willing to play what I would say Russian roulette with the disease? Or are we more likely to take our chances and be more protected on something that has been rigorously tested? And the last thing I'd like to talk about is chemicals. There have been some people that I don't want to put chemicals into my body. Well, there are naturally occurring chemicals in our environment that we're not even aware of. Let me ask you this question. Would you give a baby a chemical called isoamyl acetate? It's also known as C7H14O2. Likely your answer would be no, because I don't know what it is. Well, what's interesting is this is the natural chemical, the natural occurring chemical that gives bananas their smell. So we understand that there's a lot of research that goes into what we're doing. How do we stay our most well? And understanding that when we're looking at this, we want to look at truth and not just myths. So some of the facts about vaccines, specifically with COVID-19, is currently the vaccine is free. So it does not require insurance cards, and it doesn't even require a photo ID. If someone sees that as a barrier, that's not something that would keep them from getting vaccinated. We do know that the vaccine is currently approved for ages 5 and up. And also it's been shown that there is a 10-time reduction in hospitalization and death. So that basically means someone that is vaccinated versus unvaccinated. The unvaccinated person is 10 times more likely to be hospitalized or die from the disease. The other thing is you can get other vaccines at the same time as COVID-19 vaccination. So we just are still kind of passing through flu season, and it's perfectly acceptable to have an influenza vaccine alongside of a COVID-19 vaccine. A lot of conspiracy theories or fears have been around fertility. And does the COVID-19 vaccine make you infertile or have your inability to have children or get pregnant? And there is no evidence to support that any vaccine affects fertility. Also, the mRNA vaccine, which is the COVID-19 type vaccine that we know as Moderna, Johnson & Johnson, and Pfizer. These vaccines, the information that is provided through the vaccine into the body, that information dissolves after a few days. So it's not something that stays in the body, or it does not change your DNA. It's just information. So it would be like a piece of paper with a code on it. You give it to who needs it, and then they burn it when they don't need it anymore. It does take about 2 weeks after vaccination to build antibodies. So there have been some people to, get the vaccine, and then a day later, they're going into a party because they're like, well, I'm vaccinated. Well, that doesn't mean you're protected. So that vaccination takes about 2 weeks to build up antibodies. And then we also know that the multi-dose builds up more antibodies and more protection over time. Let's see if there's anything else. Oh, the other thing is there is something called VAERS, and that stands for Vaccine Adverse Event Reporting System. And this system is a public system that anybody can enter information if they've had a side effect from a medication, from a vaccine, even from environmental things. And what we are looking at in terms of this vaccine reporting system is it does not mean if someone listed, let's say I had vomiting and diarrhea after the vaccine. Well, it does not mean that even though I enter that information that the vaccine caused that. I could have had bad Mexican or Chinese food that afternoon and got vaccinated at the same time and actually picked up a GI bug. But then I associated with, well, I did get vaccinated that day. So it's something to keep in mind for that as well. And these are just a few statistics on cases of COVID-19, how many deaths we've had. Again, these numbers have risen since this information was created. All right, so we're going to just briefly talk about vaccine acceptance, and then we're going to pick that up in our next part in a couple weeks. So I just want to introduce the continuum of vaccine acceptance. So we've talked about this a little bit in our previous discussions, where there are people that refuse all vaccines. They just are completely against it for whatever reason, and that's okay, that's their choice. And then we have people on the other end of the spectrum that accept all vaccines. And you know what? They say, you know what, if there's a vaccine and I understand what the risk is for me, it's worth it. So we're not going to talk about people that refuse all vaccines, and we're not going to talk about people that accept all. What we're looking at is the three in the middle. This is where people can easily sway to either side of the spectrum, and we want to empower this group of people to help them make the best decision for their life. So these are the people that maybe refuse vaccines, but they're not really sure why. Or we have people that delay or refuse some vaccines. Maybe they'll get chickenpox vaccine, but they won't get the flu shot or the COVID-19 vaccine. And then we have those that accept it, they take the vaccine, but they're not really sure why or understand how it works. And so in our next section, when we come back in a couple of weeks, we'll be picking up here to talk about the group in the middle. All right, so I'm going to stop sharing my screen for just a moment. And let's talk about questions. Again, a lot of information, so hopefully there are some really great questions.
Yeah, I like how you separated the misinformation, the disinformation, and the fake news, because I think a lot of times people are sharing misinformation because they're just not educated on the topic. They hear something and they think that that's true, but they're not as dangerous as the people with the disinformation, and especially the people with the fake news. Like you said, they just package this to fit their narrative. That's why I think that we have a lot of the issues and how it is become political because of just the fakeness of it, with people just packaging this to fit their narrative, and how they have politicized it into something that it really isn't, especially in regards to how long it took to develop it. I think people think that it was just developed when when it first came out in early 2020, and then they rushed to create a vaccination. But like you said, these things are happening without our knowledge, that it took decades of research and clinical trials. And it's not like they just thought of this in 1 year and then put it out. These things were already happening, behind the scenes well before, the vaccination came out. And I think that people don't realize that. And I know even people in my family, that's one reason why they won't take it, because they think that it was rushed. They think that it just, came out and that it wasn't enough research put behind it. So they don't want to take it because of that. And so I try to tell them that this was going on long before, we ever knew about it, and so I'm glad that you pointed that out. And then another term that I hadn't heard was anchoring bias. So thank you for pointing that out, that we do often just cling on to the first thing that we hear about something, and then it gets very confusing when they change. As they learn more information, they change and give us different instructions or whatever, but we kind of hold on to, well, I thought you said, so that was a term that I hadn't heard before. So thanks for that.
You're very welcome, Carla. Thank you for your rich reflection. I appreciate that.
I got a question. I came with like 15 questions, but you answered most of them. And I was really surprised you answered most of the questions I had. But I just want to touch on a couple of questions I have. Is there anything that's has been or that's out there now that's close to COVID-19? That's one question. The second question is, you talked about the incubation stage. If the length of time for incubation for a vaccine is X, so how long is the incubation after you get COVID? When do you know that you officially can say, I don't have COVID anymore, no mas? Then the third question is, with the expansion of people that's getting COVID, is that something that's always been, or is that something that's just being reported more?
Okay, let's start with question one, so I can make sure to remember all of them. I may have to have you repeat them. So question one, I believe, was about coronaviruses. Is there something else like COVID-19 out there? Is that kind of what you had said?
Yes, yes.
So if you remember back, the H1, I think it was H1N1, bird flu, SARS. Do you remember SARS, hearing about that? MERS, those were very similar to COVID-19. So what's interesting about that, I know it kind of makes you go, wait a second.
Yeah.
I remember when that happened, and, there was some initial panic because people were flying, they were getting it picked up, it was airborne. And I would have to like pivot and do my own little research on that as well. But we were able to mitigate that and control that faster, so it stopped spreading. Whereas in this case, this virus has this specific mutation, if you will, has never been in a human before. So we were literally learning about it as it was infecting people. And, at first they thought, oh, it's only going to affect elderly. And you probably remember this. It's only affecting elderly, so young people are fine. So to talk about what Carla talked about with the anchoring bias, a lot of people had in their head, well, if I'm not older, if I'm not over 60, then I'm fine. And there are some people that are still operating in that, even though now we know that it has affected very, very young people, including children. So yes, but no, to answer that question, nothing specifically like specifically COVID-19, but we had SARS and MERS that were very similar. Second question, can you repeat that again for me?
The expansion of numbers. Are there more people that's like actually getting it, or is it just being reported more?
You know, I think it's probably a little bit of both, because if you think about how many people, especially now that we have more adequate testing available, a lot of people have taken home tests and they've been positive. Have those people called the health department? Probably not. Or let's take, for an instance, a family of 7. Maybe the parent tests positive, it's reported to the health department, and the health department says, quarantine everybody at home because you're likely, going to pass it on. Does that mean there are 7 cases, but are they all reported to the health department? We don't know. So I did read a recent study that there are cities that test wastewater. And that's how we can actually predict a community that has a high level of disease before it gets reported. And so through our urine and through our feces into our wastewater treatment plants are testing it for viral load, and they're finding viral load is higher than what they would expect according to the cases that are being reported. So if I had to make an estimated guess, scientifically based, that there are more cases than that have been reported. Does that answer your question?
Yes, it does.
Okay.
Yes, it does.
And then the third one again?
The third one was about Pacific treatments. Are there Pacific, I'm not saying the word right, Pacific treatments of COVID other than Pacific treatments, period?
Yeah, absolutely. So I think what I'm hearing you say, are there medications that we can take, or, what is it that we can do if you are diagnosed with COVID? What do you do?
Right.
Well, depending on a lot has to do with your risk factors. We do know that, as Wayne stated earlier, being of certain demographic groups is going to put you at higher risk. So if you have what we would call comorbidities or other diseases like diabetes, hypertension, high blood pressure, if you have obesity, there's all different things that are going to automatically put you at higher risk. And the reason that does is it takes us, if you look at the body like a plant, if the plant has everything it needs and the plant is thriving and it gets a little bit of a disease, because plants get diseases too, it may be more likely for that plant to survive because it's a stronger, healthier plant to begin with. But we only have, as a human being, each of us only have so much reserve. Our energy has to go through all the systems. So somebody that's at higher risk is going to have maybe more complications. I say that because I know that there are lots of physicians out there that will prescribe certain medications. If you are automatically in that high risk group, they may start on an antiviral medication immediately so that the virus does not even have a chance to continue to replicate. It's going to kind of quell that replication, because that's really where, again, looking at that viral load, looking at these are enemies or bad guys, the more of them there are, the harder it is to fight. So someone that's already at high risk, they may prescribe an antiviral medication quicker than somebody who is a generally healthy person, or if they find that symptoms develop faster. So the question, simple answer is yes. There are medications such as antivirals. There are IV medications that can be given, monoclonal antibodies, to help boost the person's immune system even more to fight this off.
All right, thank you.
Does that cover that question?
Absolutely.
Awesome. Thank you, Dwayne. I appreciate that. Great questions. All right, anybody else? So we have just a couple minutes left. What I'm going to do is I'm going to put my email in the chat. And if anyone has questions that they maybe don't feel comfortable asking today, or if you think of something later, feel free to email me. It's elizabeth@elizabethpriller.com. And I'll be happy to answer questions if you think of them later. So we will be picking this up on April 16th at 12 noon and continuing the conversation, starting with that continuum of vaccine acceptance, specifically focusing on those three in the middle, and why those individuals struggle with making that decision that's best in their interest.
Thank you so much, Elizabeth. Elizabeth has been a partner with us with this grant and the lecture series. She was with us, I believe 2 or 3 times, I think, last year. And like she just indicated, she's going to be with us again next month on the 16th at 12 o'clock for part 2, and probably additional times later in the year as we continue trying to educate ourselves and the community on this very important topic. I thank you for the information. As always, it was very enlightening and just very informational. We are recording this, and it will be available. I'll put it on our church website as well as the AACC website and the Wisconsin Council of Churches. And then I believe they also put it on YouTube, on their YouTube channel. So again, thank you so much for your research and your preparation. And we love and appreciate you as a church family. And just thank you for being with us, and we'll continue on. Okay.
So welcome.
All right.
Thank
Okay.
you. Thanks,
Thank
everyone.
you.
See you next
Okay.
time.
Okay.